Welcome to Dr. UUT channel. Stands for Umair Usmani Tohi. I was asked, that's why I'm telling you about that. Okay, today's lecture is in English, and means this video is in English. We have the video in Urdu also, and that is about the antibiotics, anti-tumor antibiotics, specifically bleomycin. What is bleomycin? It is an antibiotic that is used for the purpose of tumor. You can say anti-tumor. So what is its mechanism of action? Its mechanism of action is a little bit tricky. That is, DNA, with the DNA, this bleomycin will form the complex that is called as chelate or chelate. Chelation or chelation formation with the DNA or with the help of other ions, metal ions like copper, iron, etc. So here I am giving you example of iron. So what will happen? First of all, iron is in the form of +2, that is ferrous. When the ferrous is combined with the bleomycin and DNA, now this complex ion will undergo the process of oxidation, the complex compound. Alright? Now this complex formation will occur. After that, this complex will undergo the process of oxidation. You know what happens in oxidation? There is increased in the number of oxidation number, and there will be the loss of electron. So what will happen? The DNA and bleomycin and iron, before it was ferrous, now it will be converted into ferric. Why? Because Fe2 plus went to 3 plus. Now we told you that in the oxidation there is the increase of oxidation number. Now we got the increment from +2 to +3. So what is this called actually? This is when the positive sign is increasing, it means there are the loss of electrons. So in this mechanism from +2 to +3, what happened? There is a loss of electron. Now this electron that is lost, this released electron will react with the oxygen, or it will react with the oxygen of hydroxide ion, hydroxide radical ions. Yeah. So what will then happen? The oxygen will be converted into superoxide, and this hydroxide ion, now it will be converted into radical, hydroxide radical. Now this radical or oxygen, what is their site of action? Superoxide, not oxygen, superoxide oxygen is converted into now superoxide. Now this superoxide oxygen and this hydroxyl ion, now which is a radical. Now this radical and oxygen, which is superoxide, these two they will target again the phosphodiester linkage of the DNA. When they reach the phosphate, they will interact with that, because you know that the hydroxyl ion, when it is converted into radical form, or you can say when any radical is combined with any other substance, these radicals are hyperactive. So when they combine with those substances, with those atoms, or with those molecules, then they will react in a very drastic way, in a very stupid way. Means they will destroy the structure of that thing, or they will react with that thing. So when these react with the phosphate or the phosphodiester linkage of the DNA, like that, they will interact with that, they will do the reaction, and they will destroy the structure of DNA. So like this, the bleomycin is doing its mode of action. So this is having a site of action very specific, that is the G2 phase. So we put the bleomycin in the category now is cell specific, that is cell specific antibiotic, given the name bleomycin, which is acting at the specific phase of the cell cycle, that is G2 phase. That's why we call this as cell specific antibiotic, bleomycin. That's it all about. Thank you.